Welcome to Hiranya Medical Service.
Today we're going to be looking at Alzheimer's dementia. Alzheimer's dementia is a disease of the brain that affects an individual's ability. We will be looking at causes, symptoms, and the progression of the disease, and the current treatments that exist. So, what is Alzheimer's dementia? It is the most common type of dementia and mostly affects individuals over the age of 65. It is a progressive disease which is not a normal part of aging, and it does gradually get worse over time. Alzheimer's disease includes memory loss as a key symptom, and there are other symptoms which reduce an individual's ability to correctly respond to their environment. And this starts to change depending on which areas of the brain are affected within the disease. How does the disease progress? It progresses slowly and gradually worsening over a period of 5 to 10 years. There is no current cure for the disease and no ability to reverse the damage that has been done in the brain. However, current treatments can help slow down the progression of the disease or treat the symptoms as they emerge. To begin with, an individual is asymptomatic. There may already be some changes within the brain, but they are still able to function normally and have no problems with their memory. As the disease progresses to mild cognitive impairment, this is the early stages of memory loss and changes in what we call cognition, which is the other functions within the brain. Although there are some mild changes, the patient can largely still function independently. As the disease progresses to mild dementia, the problems with memory start to interfere with daily tasks. And friends and family may notice a change in personality, and there may be other symptoms such as getting lost or problems at work. For example, a patient may leave the stove on and forget and start a different task. When the disease progresses to moderate dementia, there is an interference with more of their daily tasks, such as personal care. The individual will no longer be able to get dressed on their own and do other tasks such as cooking, or they may forget how to get to the shops, even though they've been going to the same shop for many years. Other areas of the brain are also affected. This can cause things like mood changes, where patients can become depressed or aggressive, and they can have problems with their speech, where they can no longer say common words which they've known previously. In severe dementia, patients will need constant help with most of their daily activities, and they may completely lose the ability to communicate, and they can no longer say words. There are also more physical health problems, such as difficulty swallowing and difficulty controlling the bowel and bladder. They are also at risk of developing pneumonia due to swallowing difficulties. This can often be the leading cause of death in Alzheimer's disease. There are many symptoms that encompass Alzheimer's disease, and it really depends on which areas of the brain are being affected. The hippocampus in the center of the brain is the first to be affected, which is where memory loss emerges from. As other areas of the brain are affected, patients will struggle with geographic related signs such as forgetting common routes, not being able to drive home, and getting lost. Their emotions can begin to be affected, leading to depression or aggression. Patients can also start to withdraw from their normal social interactions. There is also some signs of psychosis later on in dementia, which includes delusional thoughts that aren't true and hallucinations such as hearing voices. Speech can be affected in two ways. They may not recognize common words that are being said to them, and they won't be able to say common words which they've known previously. When vision starts being affected, individuals can no longer recognize common images or understand non-verbal cues. This can be particularly dangerous as they can no longer understand traffic lights or common road signs. Other aspects that can be affected include decision-making, judgment, and problem-solving, which all begin to show within their daily lives. There are several changes that happen within the brain, which can be used to explain the symptoms. Neurons are nerve cells, which are very important for carrying electrical signals around the brain and to the rest of the body. In Alzheimer's disease, there is a buildup of plaques and tangles around these neurons or nerve cells, which means fewer signals are being passed around the brain and causes the death of brain cells. Plaques are specialized proteins called amyloid. These build up outside the nerve cells, as shown in the diagram. Tangles are proteins called tau that build up inside the nerve cell. This combined damage causes death to the cells, and when many cells start to die, there is shrinkage of the entire brain, which is known as atrophy. And it is this atrophy within the brain that causes the change in symptoms that we see. Doing a CT scan or MRI scan of the brain can show these global changes within the brain, which aid diagnosis. Alzheimer's disease was first described in 1906 by a German scientist called Dr. Alois Alzheimer, who linked the changes in the brain seen under a microscope with the symptoms that patients experience. Alzheimer's dementia is at the forefront of research, and current treatments look to slow down the progression of the disease by maintaining good blood supply to the brain and reducing the number of proteins being deposited in the brain. There are other things that patients can do to slow down the progression. For example, good lifestyle factors can slow down progression, such as exercise, a healthy diet, and avoiding smoking. Good social interactions can also help maintain some of those cognitive skills. Currently, drugs can be used to treat the symptoms. For example, patients experiencing psychosis, such as hearing voices in hallucinations or having delusional beliefs, can be treated with antipsychotic medication. And patients experiencing depression can be treated with antidepressants. There is more research looking into actually reversing the cause and curing Alzheimer's disease. However, no drugs have currently been proven successful. So to summarize, Alzheimer's disease is a progressive type of dementia affecting individuals mostly over the age of 65. It causes shrinkage of the brain, which leads to memory and cognition problems. Although there is no cure, drugs can be used to slow down the progress and treat the symptoms. Changes in lifestyle factors can also make a big difference, and early diagnosis helps patients as they progress. Thank you very much for listening to this talk about Alzheimer's disease, and I hope you've enjoyed it.
Thanks for watching. Do like, share, subscribe and click the bell icon button to receive instant updates.